Hi, I'm Dr. Rahul Bharad. I welcome you all to my series What Life Has Taught Me Yesterday. Today when I'm recording this video is 27th of April 2023. I'll be talking what 26th of April has taught me in life. Yesterday, most important lesson in life came from a patient. Usually I don't like to discuss too many patients and whatever we do in our professional life in this video and everywhere, but sometimes some patients are very special, some incidences are very special, and they need an explanation and mention here. So similar thing happened yesterday. I was there on duty hospital yesterday afternoon. Suddenly one patient came in emergency. Parents were complaining that a 4.5 year old female child was having abnormal movements of the limbs. Usually abnormal movements of the limbs in this age group is because of seizures. It is because of neurological condition which affects brain, and children, they throw convulsions, they go unconscious, and they will have abnormal limb movements. So that child was brought in emergency and was immediately brought in front of me for examination. When I started examining that child, she was conscious, she was opening eyes and having abnormal limb movements. So sometimes it happens that children are conscious but they throw convulsions and they have abnormal limb movements also. I immediately asked parents, was she having any history of similar movements in the past? They said no, there was nothing significant in the past which will suggest that this can be epilepsy or seizure disorder. So the point I want to stress is that I thought if she is conscious, I asked parents, is she responding and is she talking? Was she talking while coming to the hospital? They said yes, she was responding and talking while coming to the hospital also, but she was having in front of me also abnormal movements like this. So I said, I started talking to her. I asked her name, I asked her about her school. As a 4.5 year old child, she is going into school, and she told her friend's name and school's name, etc., etc. Gradually those movements came down. They actually stopped for, suppose, say 30 seconds, 1 minute. Parents were surprised, even I was surprised that after talking those movements had stopped. So I continued talking to that child. She was more interested in talking. As she was explaining more and more things about her, her movements stopped. As soon as I stopped talking and we wanted to see what happens after she stops talking to us, gradually those movements reappear. But when we involved her in talking again, those movements stopped again. So that gave me confidence that it is not seizures. Seizure movements will not stop like this. Why I want to mention here is that if I would have taken that abnormal movements as abnormal thing and immediately admitted her and started treatment also for seizure disorder, I would have missed one point, simply because not taking proper history. In that 1 minute, I just took proper history. After taking history and after looking at the child, I thought I need to sort it out. What is this? What kind of seizures is this? Because she was looking conscious. So there was no serious issue, I can say, apart from those abnormal movements. So I took time. I took history in that small 1 minute I had with the parents and examined the child. Thanks to all the history taking and good examination, all the movements stopped. She went on talking. She was absolutely normal. It hardly took 3-4 minutes. Took 3-4 minutes for examining and settling her in my OPD only. The most important lesson I got is that history taking is very important. If I wouldn't have taken proper history, that wouldn't have been possible to stabilize that child without any medications, without any IV fluids, without any injection also. She became absolutely normal. Parents were so happy. Actually, it was their first visit to our hospital, but they were so happy. They were very much worried about all those movements, and they were very much apprehended. Once they saw that child is responding well, she is talking well, she has become normal, the joy on their face was tremendous. They were so happy to see her becoming normal, and I was relieved that she has no convulsions. So again I continued talking to her for 4-5 minutes more, and then we came to conclusion that it was not because of some convulsion or seizure disorder or something like that, but it was some fear she was having. from one of her elder brother, someone in the family, who had scolded her, and that reminded she had reminded when she was at home, and she had those movements. So fear or panic attacks can present like this. Fear can cause much trauma to children and that was the case. So most important lesson we as a parent and as a doctor we got is that history taking should be given more importance, and examination, history taking and proper examination will solve so many problems. At the end, I sent her back home. Parents were happy. She was playing playful, alert, responding to all the commands, and we used no medications to treat her. It was just counseling, and that is what the most important thing in the treatment of that child yesterday. So that was very interesting, and I wanted to share this experience. Usually we don't like to discuss cases, but such cases need to be discussed, which will underline the importance of history taking and proper examination by the doctors and giving proper history by the parents. If those parents would have given false history, I wouldn't have come to a good conclusion. So it is important for parents to give proper history to doctors. Whatever questions doctor asks, it is duty of the parents to give all the details to doctors so that doctor can treat their child in a better way. Most important news I came across yesterday is about artificial intelligence. It is very interesting news because machine learning, artificial intelligence has discovered a new planet outside our solar system. This is the first time artificial intelligence has analyzed our data. That data was there previously, was being analyzed by astronomers earlier also, but this discovery of a planet has been the first step that an artificial intelligence has discovered a planet. And it took not more than 1 hour for artificial intelligence to analyze all the data which was gathered by the astronomers earlier and to find out that there is a new planet. So this is interesting. This can be the first step towards analysis of more and more data of astronomy and discovery of many more things in future. So I'll be sharing link in the description box about that news. If you want to read more about that, please go to the description box and read about that. For today we'll stop here. Bye bye.